Now, RSV is a leading cause of lower respiratory tract illness in young children. Could a new vaccine for pregnant women be the answer? Here to discuss, our PIDS president, Dr. Buddy Creech from Vanderbilt University Medical Center, and Dr. Amy Law from Pfizer. Dr. Creech, let's start with you. The current impact of RSV, big talker, clinically and economically.
This is an incredible time for us in human history because for the first time, we're going to be able to prevent one of the most significant respiratory viruses that we see in kids and adults. Every year during the RSV season, about 500 children a day are admitted to the hospital, and about 500 older adults are admitted to the hospital with the equivalent of RSV pneumonia. We can now begin to prevent something that costs tens of billions to our healthcare system. This is a good thing to celebrate.
And let's bring you in, Dr. Law. So there's a recent study about the effectiveness of the vaccine. What were the big findings?
The big findings that we had was that with the maternal vaccine, we can prevent as many as 200,000 cases, RSV cases, and among infants, less than one. And that's associated with a savings of up to $800 million. And this is with the clinical efficacy of almost like 69% against severe RSV disease among infants.
And my understanding is that the finding is pretty conservative.
Of course, yeah. This is based on modeling approach, and so with every model there are a number of inputs and assumptions, and some of the inputs, such as the effectiveness of the vaccine, this is based on a study that was conducted during the pandemic, and when it's out in the real world, the effectiveness may actually be higher.
Which would be great.
Yeah.
And Dr. Creech, from your research, when do you think vaccine will be available to a whole wide spectrum of folks that you touched on?
There's a vaccine or a prevention for almost everyone. We can vaccinate moms late in pregnancy, and that provides protection not only for them, but more importantly for their babies as they're born. Secondly, we can give a monoclonal antibody called nirsevimab to the infants during RSV season and provide protection for maybe at least as long as 5 or 6 months against pneumonia from RSV. But then the ones we don't want to forget are the grandparents, the ones who can get a vaccine themselves to not only protect them against RSV, but maybe most importantly to protect their grandchildren. So what we're effectively doing is we're protecting the individual, but we're also trying to build a cocoon around them. So except for those of us who may be in that sweet spot of infancy to retirement, we don't have anything yet, but for pregnant persons, for infants, and for the elderly, now's the time to be talking to your provider about how to prevent RSV.
Well, a good sentiment to leave this segment on. So Dr. Creech with Vanderbilt, Dr. Amy Law with Pfizer, thank you so much for being here with us.
Thank you.
Thanks so much.